My name is Jeanne Rungby. I'm an ear, nose, and throat doctor from Denmark. In 2021, I observed that my mostly young patients got all sorts of diseases in close temporal relation to the COVID-19 injections. When I heard about the impurities of artificial DNA, including the SV40 gene fragment in the vials, it all made sense. One would expect many more autoimmune diseases, allergic reactions, and cancers if this was true. It was also revealed that Pfizer shifted from a clean to a dirty manufacturing process after approval. Process 1, the clean process, refers to Pfizer's basic clinical trials in humans. Process 2, the dirty process, referred to the large-scale commercial product given to billions after approval. I wanted answers, so I sent questions to the Danish Minister of Health. Answers came from the Danish Medicines Agency. Citation: no placebo-controlled randomized clinical trials in humans have been conducted with material from process 2. This was their words, not mine. No clinical trials in humans for a product given to billions. And they continued, it is not unusual for a pharmaceutical company to make changes to its manufacturing process during the development of medicine or a vaccine. In other words, not only for vaccines, but for medicine in general, this practice of allowing changes to the manufacturing process after approval is business as usual. What other medicine and vaccines have been approved for this procedure and for how long? Given the history of SV40 virus in polio vaccines and the proven connection to cancer, why did they approve the presence of these fragments in the vials? They confirmed the presence of these very small fragments of SV40 in Pfizer's vaccines. Citation: it is unlikely that the SV40 fragment used in Pfizer's plasmid can behave in any way like the full virus, and therefore these fragments pose no risk of developing cancer, nor can they insert or alter the human genome. This is twisting the facts. This specific tiny SV40 fragment, not the whole virus, is normally used in gene therapy when genomic changes are wanted. Don't medicines authorities know this? Something is obviously wrong with the regulatory processes. They also admitted that, citation, it is correct that it was not specified in the application from Pfizer that the DNA plasmid contains small pieces of SV40 sequences. My following question: should this omission in the application not have consequences for Pfizer? I got no answer. In my view, this has gone too far. Manufacturers, as well as regulators and health authorities, must have responsibility. These products are too dangerous and must be halted and recalled. Thank you.